Hello, my name is John Copenhaver, and today I'll be talking about small cell lung cancer. Small cell lung cancer can have effects on your body as it's very hard to breathe. You have diarrhea, vomiting, you're very tired, you cough a lot, you're weak, you get mouth sores, and you lose your hair. You cannot inheritance lung cancer. Screening and testing methods are lung screening. Treatment for lung cancer includes radiation and chemotherapy. Radiation, what it does, it shrinks down the tumor, and then you go from radiation to chemo. And chemo is it's a pro and a con. Chemo can help you survive through cancer longer, and then it also kills blood cells, and it weakens and breaks down your bone marrow, which is the squishy stuff in your bone. The complications of the treatments, like I said, chemo, you have diarrhea, vomiting, you lose your hair, and you feel nauseated. To prevent lung cancer is chemo. New discoveries in lung cancer is nivolumab, and a combination of nivolumab plus ipilimumab. Statistics and incidences in lung cancer is the second most common cancer in both men and women. Lung cancer is the leading cause of cancer death among men and women. Lung cancer for both non-small and small lung cancer is about 222,500 new cases of lung cancer, which is approximately 116,990 in men and 105,510 in women. About 155,870 deaths are from lung cancer and are 84,590 in men and 71,280 in women. Risk factors are cigarette smoking is the number one risk factor for getting lung cancer, and smoke from cigars and cigarettes can also be a risk factor, and which when you inhale those fumes, you can get lung cancer, which is also known as secondhand smoking. To prevent getting lung cancer, you can get counseling, nicotine replacement, and other medicines, and convince young people to never start to smoke. Diagnose. When you're diagnosed for lung cancer, the state-of-art diagnostic tools, including advanced imaging and laboratory testing to evaluate lung cancer. Fluorescent bronchoscopy is a technique that doctors use to help find lung cancer earlier on before it starts to spread, and you're most likely to get it to have it treated easier way. Cell cycle. In interphase, cells are growing, replicating DNA, and doing their ordinary cell functions, which is 90% of the time. And when they're not in interphase, they're in mitosis, dividing, which is 10%. So if we were to flip-flop those two roles, as in mitosis would be 90% and interphase would be 10%, we would have uncontrolled cell growth, and we would for sure get some type of cancer, which means they can't do their actual functions. Checkpoints are which the cells have to go through checkpoints to make sure that they're growing correctly, replicating correctly, and if the cell fails at that, then they do a process called apoptosis, which is really when the cell self-destructs itself or kills itself. And if it did not do that, if it didn't do apoptosis, then like I said, it would grow out of control, and it would cause some type of cancer. Next up will be an interview that I did with my mom, and how it affected her life, and etc. Copenhaver, and today I'll be interviewing my mom, Stephanie Copenhaver, and how the effects of lung cancer, aka my grandma, her mom, how it affected not only her family and her siblings, but also the family that she's raising today. So the first question that I have is, how did having your mom have lung cancer affect you and your siblings?
So how it affected us is My brother and sister and I were living in different states. My sister had a little girl. I had 4 kids under the age of 5. Um, and we were counting on our mom to be a part of helping us raise and be involved in, your lives. So we were devastated, and the prognosis was very grim and very short, the time that they gave us to deal with. So it was a matter of us coming to grips with how to help her, and then trying to help her realize she was on very limited time, and how to best deal with that information, and the health part of it too, like just not feeling good and the side effects of all her treatment. And it was just a super tough time. The good thing was, I was had a great community of people that helped me. So in the 9 months from the day she was diagnosed, she died exactly 9 months later. And in those 9 months, I was able to go from Roswell, Georgia, to Sacramento every 8 weeks and be with her. And people donated flight miles, and we knew somebody at the time that worked for Delta, and they gave us some first class tickets. So I was able to go every 8 weeks and be with her and help her with her treatment, and go with her to her appointments, and just help her when she wasn't feeling good and could barely get out of bed. So that was awesome.
Okay, and how old were you when your mother was diagnosed with lung cancer?
39.
39, okay. And where were you in your life?
Like I said, I had 4 kids under the age of 5, and did not have family in the Roswell area. So when my mom, your grandma, came to visit, it was awesome, and just loved having her be a part of raising you guys. So we were in a very busy part of our life, trying to manage everything.
Okay, and where were you living at the time when your mom was diagnosed?
We were in Roswell, Georgia, and my mom was in Sacramento.
Okay. And who else took care of her other than you?
My younger sister, and she actually lived with her at the time, so she could help her on a daily basis.
Okay, and that wraps it up for our interview. Is there anything else that you'd like to say to those who are fighting for cancer?
I would tell anybody to never start smoking to begin with. It's very addictive. It's very hard to stop the habit, and to just not do it to begin with. And that it's just a hard thing to help somebody when they have such a hard treatment ahead of them. And it's tough.
All right, thank you, Stephanie.
You're welcome, John.